Hello, my name is Crystal Logue, and today I want to speak to you more about pain management and detection in the geriatric population. Elderly men and women represent the fastest growing demographic in the world's population. By 2040, the number of people aged 65 and older worldwide will increase to 1.3 billion from the current 506 million. In the United States alone, the elderly population will increase from 40 million to 80 million by 2040. It is not a normal part of aging, but a significant proportion of the elderly do experience physical discomfort. Studies suggest that 25 to 50% of the community-dwelling elders report pain, and that for the elderly residents in nursing homes, the prevalence of pain is as high as 80%. With adequate treatment, then there's going to be less functional impairment and increased quality of life for these elderly patients. Other consequences may include sleep disturbances, depression, anxiety, decreased socialization, cognitive dysfunction, polypharmacy, malnutrition, and increased costs associated with their health care. The prevalence of chronic pain increases with age, along with neuralgias and joint pain. A significant proportion of elderly individuals experience daily pain but fail to receive adequate treatment. Undertreatment is exacerbated further by a lack of efficient methods for detection and management of geriatric pain. A study of elderly nursing home residents was found that 66% of them had pain. However, the physician assessment only detected 34%. The geriatric pain assessment is a complex clinical process, and it's influenced by several factors. Complicating factors include cognitive or language impairments that diminish communicative abilities, coexisting illnesses, concomitant medications, and the cost of drugs. Assessment can be impacted specifically by negative mood states such as depression, heightened anxiety, psychosocial concerns, poor memory, and failing health. Elderly patients may underreport discomfort thinking that pain is just an inevitable part of aging, or because they believe their physician is just too busy to hear such concerns. Additionally, the elderly may fear the meaning of the pain and worry about the possible side effects of the medications that treat the pain. Patients and healthcare providers alike may also avoid the use of opioids because of misconceptions about addiction and tolerance. There needs to be more reliable and valid methods of identifying, diagnosing, and understanding pain in older individuals. These problems have been the focus of increasing studies and research. The geriatric pain assessment requires a comprehensive and multidisciplinary approach to the description, diagnosis, and management of chronic pain. Physicians, psychologists, psychiatrists, and physical therapists should work together to develop pain management strategies based on their individual evaluations of the patient. Meeting with patient caretakers as well as laboratory or imaging studies may be necessary if the initial workup does not provide sufficient information for a diagnosis. Evaluations of patient functional abilities and performances are included in this assessment. Impairments in functional status may impact the degree of their independence, quality of life, and need for caretakers. Assessment of patient daily activities and habits, such as the activities of daily living and the instrumental activities of daily living, ferrets out possible functional limitations. This information can then be incorporated into treatment plans toward the goals of maximizing patient function and decreasing their pain perception. We should be using verbal descriptor scales, numerical rating scales, and visual analog scales because all three have been supported by current data as being valid. You should make sure you're taking a detailed history with your physical exam. You're going to do a review of symptoms, review of the laboratory data, imaging studies, and diagnostic tests. You also want to review the location, intensity, and other factors associated with reported pain. Make sure you have a baseline functionality, which can determine the evaluation of the ADL's balance and gait. Additionally, evaluate the patient's psychological functioning and their present social and living situation. I'm going to leave off with the ways that this pain can be treated. Pain treatment modalities for the elderly may be classified into the following 4 groups. You have pharmacotherapy, physical rehabilitation, psychological support, and interventional procedures. A whole nother study video that I could do right now would be including non-opioids, opioids, adjuvant analgesic drugs, other drugs, therapeutic exercises, physical modalities, acupuncture, and types of psychological support and interventional procedures. But I'm just going to leave off with just the actual assessment of the pain. If y'all have any questions, let me know. Thank you.